Again, welcome today to our ICD-10 webinar series. Today we're talking about the value of custom training and preparing for ICD-10. And we have joining us today from the Medical Management Institution, Dari Bonner and Carleigh Benscoter. Hello, Dari, are you with us? And Carleigh?
Yep, we are here. Thanks for having us, Tamara.
Great. Thank you for joining us. I know you guys have a lot of good information to share with us. Dari is the Chief Training Officer at Medical Management Institution, and Carleigh is the Director of Marketing and Member Services. So I know we're looking forward to hearing what you have to share with us, and we're already getting questions coming in. So briefly today, you guys are gonna give us an introduction to MMI and what it's all about and your training options. Little brief reminder of why we're here today talking about ICD-10, and then the value of bringing in professionals to help with that transition, some training tips, and I know you have some special offers for people joining us today. So let's get started. Okay, Carleigh and Dari, can you tell us a little bit about Medical Management Institution? I've heard great things about you guys from the industry.
Sure. This is Carleigh, by the way. Hi, everyone. Thanks for joining. Just to begin, yes, I'll give a little background on MMI, and then Dari's going to take over and give an overview of ICD-10 along with some steps you can take for a smooth transition. So the Medical Management Institute, or MMI, is the leader in live and online training and certifications for medical professionals, specifically in the physician office and outpatient setting, although we will do consulting services in the inpatient and hospital setting as well. Our main focus is on training and certifications for coders, billers, clinical staff, and providers. And MMI has been in business for nearly 30 years. So at this point, we have nearly 250,000 alumni. So we really have a great networking group, which is included in our membership too.
Oh, great. I didn't realize it was that large.
Yeah, over 30 years you get a lot of
that's right.
come and go, and yeah, they're great. And typically they're all in the outpatient physician office setting. So yeah, so we have groups on LinkedIn, and we use the social media so people can all kind of keep in contact. So that works out really well.
So what sort of sets MMI apart from other training options?
So what sets MMI apart, first of all, is along with our live training, we offer everything online. So any of our training, any of our certifications, continuing education courses, it's all administered online through our password-protected learning site. So this includes access to the networking groups, access to group discussions, instructor support. So everything can be accessed online. Along with that, the training programs that we do offer, they're authorized through MPEC, which is the Georgia Non-Public Post-Secondary Education Commission, and the Institute is A+ accredited through the Better Business Bureau as well. So,
Great.
And just to mention too, and we can go into this also at the end with Dari, all of the training, it's all pre-built, but it's all customizable. So depending on who signs up, if we have a big group sign up in like a physician office, you know, and they want to customize it to the setting, we can customize all the training. So
Great.
we can move things around.
So here today we're talking primarily about ICD-10 training and some of the options for that.
Yes. So like I was saying, our ICD trainings, like our other training, we do it live and online. It's available to all medical professionals, specifically in the outpatient physician office setting. Our online training specifically, it simulates the live environment. That's how we built it. So it's about 6 to 8 hours long, self-paced, really not too long because we really dive into your specific specialty.
That's awesome. Yeah, that really, I thought that was very interesting that you do specialty-specific training.
Definitely, yeah, because we're really going towards people that are already in the field. So, you know, they already know CPT, they already know the HCPCS, all that kind of.
Well, that brings up, where do most of your trainers come from? What are their backgrounds?
Typically, they're going to be in small physician offices, but we have clients from, I mean, every kind of setting. We even do the hospital if they're doing outpatient coding. We have billing groups that go through the programs. So because the programs are so customizable, we have a pretty large, kind of a broad range of audience, but typically we'll have physician offices, so billers, coders, clinical staff.
And your trainers, how are they certified, or how does that work?
Yep. So our
Okay,
trainers, yeah, and typically they go through a lot of different organizations, not just MMI. So they'll have their certifications through MMI. A lot of them are going to be certified through AHIMA as well for ICD-10, so they kind of have that broad knowledge too.
great.
Um, but for specifically for the online training, it was actually built and instructed by Dari, who's going to be getting on in a second to kind of go into it.
Great.
So it's all pre-recorded training videos of Dari going through the material, helping you through it. So
It's
um,
self-paced and easy to
yep,
access. Yeah,
yep, self-paced. So it's 6 to 8 hours long, but you can break that out however you want. You just log in and go through the videos and material at your own pace.
great. Okay, let's jump into briefly why we're here again today. And every time I've been hosting this series, and every week the panelists has sort of a different take with a little more information on ICD-10 and why this is happening now.
Yeah, and I'm going to let Dari, you're on the line too. I'm going to let you take it over since, like I was saying, Dari is the main trainer when it comes to ICD-10 for MMI. So she is on the call, and Dari, you can take it from here.
Well, it's we've talked about a couple of times. Hi, everybody. Thank you for joining us. We've talked a lot about ICD-10, why it's here. Oh my gosh, it's suddenly here because it was delayed quite a number of times. And so, you know, what makes this different? Actually, the reason that ICD-10 now has come about is because of the fact that it was part of the Affordable Care Act. A lot of people don't know that. They do understand that the electronic claim submission, 5010, all of those elements of ICD-10 became law, but a lot of folks don't know why it's coming around now when we've been talking about it probably since the early 90s. And the reason is because of the Affordable Care Act. So we kind of knew it was coming, although we had 3 delays again. That would be called government pace. But it's here, and it's definitely going to be going through. And basically, what you really need to know now, a lot of folks on the telephone probably are saying, oh my gosh, I'm so late. You know, what do I do at this late date? The first thing I would tell you to do is catch your breath because it is manageable. I know there seems to be a short amount of time. There's a lot of other things we've had to implement because of ACA. So it's understandable that a lot of people would wait until this point, but you know, you can still get to that next level and do what you need to do to make it happen.
Right, and a reminder to people, this has been around since '92, and we're one of the
That's
last
right.
countries to actually implement it, so it's about time we get on board, and
Yeah,
it is
that's
going to
right.
happen. Yeah.
And it's interesting that you say that because one of the reasons the United States really didn't implement it at the time of every other country, actually Canada was the last country to adopt it in 2002, believe it or not. But a lot of the reason is because the PCS portion of ICD-10 was not adopted by other countries, only the
Oh,
diagnosis portion. And so we had such a huge change within our healthcare industry, plus they're all one payer. So
right.
they use other procedure coding systems, so I think that that's probably the reason it took so long here and why it actually took an act of Congress and a bill
Yes.
or a law to make it pass.
Yeah. Thank you, Dari. And let's go on to, I know you have some simple steps for folks to follow and to help with their transition. If you could walk us through that.
Yes, one of the key things that that we see in the industry right now, and the fears are less, I think, related to am I going to know how to code in this system, versus all of the areas that are impacted and the fear of what they're all individually responsible for. So what we've given here is sort of a 5-step process to tell you each individual area that is going to be impacted. Step 1, I know that we've talked about this many, many times, but a lot of people have not been instructed on exactly what direction to take to get these things done. Current software systems and office processes that you use for ICD coding, and without the number, within your systems are very important. So vendors are letting us know that they are ready, and the vendors, when they're telling us that they're ready, they are ready and have been actually since 2012 with that transition of that ICD-10 code, whether through electronic claim submission, whether an encoder that is available within all of the vendor software products. they do have the ICD-10 system embedded in their vendor products. We've heard less about how it, say a physician is impacted through the electronic medical record and looking up those codes.
Right.
We've heard less about clinical documentation and the emphasis on that for the provider. Unfortunately, in most provider settings, a large majority of them, we don't have coders that can report that data. We have doctors that are actually coding for those services. So providers are kind of feeling the squeeze on the fact that they have to be responsible for correct documentation and things like that. How do you do that now? Well, the very first thing is, and I will say, I would not hand a physician a big fat notebook and tell him here's all of the conversions from ICD-9 to ICD-10, which we you know, I mean, orthopedics alone could have up to a 96-page super bill. So whether that's electronic or whether that's a manual charge slip, I think the process needs to be focused on the most. So clinical documentation, your EMR systems, charge slips and super bills. For the most part, if you have hard copy super bills, you do need to transition, even if you do it to the unspecified category code within the ICD-10 category. The practice management systems, again, how do we use those encoders in all of these systems, and who in our practice is responsible for touching that? Could be clinical people, could be doctors, could be a number of different people. Electronic health records, of course, payer contracting and quality reporting for PQRS and HCC. Again, all of those things are related mostly to the EMR and the practice management systems. The second, I'm sorry, go ahead.
I just want to quickly remind people that on our website we have an ICD-10 resource page, and on that page we have links to our clearinghouses who have listed payer readiness list, and those are updated daily.
And that goes to step 2, so that's a perfect segue into the next step. Identify your potential changes to your workflow and your office processes. For the most part, if all of us on the telephone would admit it, we haven't been super prepared for this type of detail, not just in the coding, not just in the narrative forms of those numbers that are going to be different, but in ICD-9. We do a lot of unspecified coding within ICD-9. That's been 38 years. So transitioning to ICD-10, I would take this opportunity in practices and hospital settings to make sure that you change the workflows that in all reality we should have changed a very long time ago. I would take this opportunity from a positive perspective to change the way that we do business, because that's a lot of times what we don't emphasize, and ICD-10 can give you that capability to do that. Clinical documentation, again, you know, do we have to tell anybody on the telephone that it always goes back to documentation? It doesn't matter if you're talking about a new coding system or whatever, a version upgrade. Charge slips, again, and updating those on an annual basis. Your public healthcare reporting, coding. Again, we've talked about the fact that most of us don't have coders within our physician settings. You know, that's going to be very, very important. Our providers currently are coding, so it wouldn't be a bad idea to probably give them some assistance on that side of the fence. And billing, of course, billing and coding are very, very different things. A lot of times we utilize our billers and we put them all in the same cone, and they filter out as coders, billers, and everything else. The reason that we do that is because from the very front of the process within our practices, everything goes downhill. Nothing personal to billing. I started in billing. But you all know that, and you know that whatever happens up front or doesn't happen up front, you will be responsible for in the long run. Accounts receivable and denials management. We hear a lot about the fact that there's going to be a lot of denials, that, you know, the fear on that side. I do have to, and we'll go over this in a little bit more detail in just a minute in the other step, but you do want to prepare, you want to pull from a medical necessity perspective. Remember, we get paid on CPT code. We don't get paid on diagnosis code, but medical necessity is a big issue. So what I would recommend is that you run a report in your billing side to determine what denials you've gotten because of medical necessity.
Good point, yeah.
And then that could really help you emphasize and have a focus for your own individual practice to know what's coming and what you do have to focus on in your own specialty, not the entire book.
Quick reminder, Dari, we do have a number of our customers for practice admin or billing services companies. So if you have any suggestions for them as well, I know that all this is good information for them, for their customers.
Right. And that's the key thing is, again, for those customers that are billing, you see that you get everything. You know, you get all of the issues on the back side. I never liked being called the back side when I was a biller. Um, so I'd like to change that to end result, right?
Yes, yes.
But in order from a billing perspective to try to help provide guidance to the front end component, because the billing is going to be responsible. I understand that we don't code in the billing, but they will be responsible for the denials and managing those denials. So they do have the capability, those billing companies, to run these reports on behalf of the practices that
Yes.
they're supporting, and it would help them to be able to perhaps provide guidance at the very least of here are the key areas that you really need to look at that we continue to have problems with in the medical necessity arena.
Right. Thank you. Okay, let's move on to the next steps.
On step 3, you know, the training needs of your staff is imperative. A lot of times we don't break these down either. Administrative staff, you know what, it's good for administrative staff and the executives, office managers, folks like that, that are running the practice to know what's going on, certainly. But to learn how to code and become a certified coder overnight might be a stretch while you're doing everything else in the practice. So a big picture concept, which going back to what Carleigh was talking about, our online programs are based on showing the big picture and all of the changes from a big picture, and then breaking it down by specialty of those big picture concepts that impact the individual specialty. The clinical staff, really, if the clinical staff could do nothing but focus on documentation. Documentation has always been our issue. That doesn't mean also, look, we have what we call the 2%ers. The 2%ers are those providers that have always had bad documentation. So let's try not to throw them all in the same room and beat them with a broom and tell them that all of them need to relearn everything they ever learned 20 years ago in med school from a soap note. Let's focus on those providers that we may see, and in billing you would see this, that we may see are a consistent problem with our levels of service or those types of things, so that, again, we can help the clients potentially focus on those providers that may be problematic, that never really did great documentation previously. And then the coding and billing staff, of course. I know that we're not talking about the coding as much in most of the training that we've seen, although we do on the inpatient side. I think this is a wonderful opportunity for outpatient for the first time to really focus on the need for coders. We have a lot of regulatory audits and things like that that are starting to come out, that have been coming out since ACA. They are not going to slow down. They're going to continue. And so those coders would be beneficial, not just for the coding and ICD-10 transition, but also all of the audits that we're getting within the practices. The billing staff, again, the coding and billing staff will require the most training. If our billing staff don't have certified coders, they're still going to have to know how to manage denials and how to keep up with that process.
Quick note here, I just want to remind people again that we did have a webinar back in August about coding and bringing in, so for example, Dell coding services, and we have a relationship with them to help our customers to use those services on an as-needed basis to help supplement during such times as this.
Mm-hmm. And then step 4, communicate with your payers, like you were alluding to in the beginning of the presentation, about any changes that are going to be made to contracts based on, and you know what I got to say, I've kind of gotten to the fact that that word conversion kind of bothers me, because and the only reason is because we've taken that word and we're like, oh, everything's fine, everything's going to be great because we've converted the codes. What does that mean? Well, when I-9 goes away, there's not much of a conversion going on. And I-9 is not going to go away completely, because as we know, we will still need to utilize I-9 for workers' comp and State Farm and a lot of those insurance payers. So even in those cases, from this last part of it, when you're talking about your payers who will not be transitioning to ICD-10 potentially as far as your payers, because you're going to have to really delegate who's going to be responsible for one part and who's going to be responsible for another, just to kind of keep their keep them from going crazy on the
Right.
billing side. Possible change to billing fee schedules, reviews, auditing and coverage, medical necessity again, LCDs, NCDs, all of those things are going to affect us as far as denials management and the billing component of it.
Mm-hmm.
And then each payer really should be contacted, like you said, I think you said it was
Yes.
on your website, as to which payers are ready and which ones that you may have to do some additional
Right. And it
reaching
is up to you, to the people, to contact their payers to see if they are ready and if they're testing.
Absolutely.
But also
Yeah.
we're suggesting to our customers to create sort of a sheet of their top payers with their contact information, names if they've been talking to them, to have that handy.
Right, and I want to add to that. Thank you for bringing that up. Let's add to that too, because a lot of people on the phone are probably thinking, "Oh yeah, like I have till next Wednesday." Well, really, from a perspective, you can do that in a
Right.
day. Make
Yeah.
that a focus, because here's the thing: you only really need to send them 5 or 10 claims.
Right.
Just set aside those claims and just make sure that they can accept those claims and that you won't have any problem in that communication. As we all know, the insurance companies, no matter how much prep they actually have, which they've had years, no matter how much prep they have, in all reality, a lot of times they end up being the problem.
Yes.
Where, that really, we can't control what happens on their side, but we can try to minimize that impact on our own facilities.
Right.
And focus on just the few that will be a problem.
And I would say for those of us who survived 5010, we know that it does come down to the payers.
That's right. That's exactly right. And then we have one more step, budget for cost to convert. Again, there's that word. I'm sorry. I didn't change it, but to transition.
Let's
I like
say
that word a lot better.
Yes.
Yeah. So convert means transition for everybody on the telephone. Budget for those costs. I know you may think again that it's kind of late to the game. I do want to make sure that we emphasize one thing that I think a lot of people aren't being told. Don't forget, and this is not taken away from the fact that we may have issues, particularly in billing, but considering most of our audience is billing, I need to make sure that we emphasize Medicare, and I know anytime we hear that word, it's like, yeah. Medicare has committed, CMS as a whole, has committed to the fact that for this next year, they will pay claims, okay, if we're in the right category of codes.
Right.
That would be the first 3 digits. And we have the right number of digits, that, like, for instance, if it goes to a 4th digit specification or a 5th digit or a 7th digit, whatever that maximum specification is, as long as we're in the right first 3 digit category, they will pay us for those claims. And that, to me, for those of you that are kind of fearing and dreading this transition, I do believe that gives us a little more time. Now, I would emphasize that we do not tell our providers per se that they have another year. I would say 6 months.
Yes.
For them to learn the language and learn
Right.
these codes, but it's not going to be a drop dead on October 1st. So
There
for
will be
those of
some
you that are
leniency.
fearing that, there will be a little bit of leniency. For those of you that are going to probably ask the question, since when do we believe what CMS tells us, I will tell you this. This is a national transition, and I'm going to tell you they will not stop paying everybody.
Right.
It's an impossibility. So I do believe that they will give us that ability. I would say to try to get it up and running as fast as possible, because what we also then don't want, that most of us have seen in the past with Medicare, is that they then basically utilize that data to measure us in the future. So get it done as fast as possible, but you do have a little bit of leeway, and from that perspective, just make sure that you understand that and that your providers understand
Right.
that as well.
And we're telling our customers to run a primary diagnosis code report in our system to identify their top codes. You don't
Right.
have to learn all the codes out there. Learn the
That's
codes
exactly right.
for your practice that you
Yeah.
use. And that from that, you can crosswalk to the ICD-10 codes to create your cheat sheet.
And look at the fact, too, that when we talk about that transition, that's an excellent point that you make. When we talk about that transition, we've heard the number 180,000. Well, for providers, the only impact is 77,000 codes from somewhere in the range of maybe 15,000, right? But that's all codes. And understand, too, that one of the biggest increases were the E-code sections from I-9 to I-10. And we're not mandated to utilize those unless a state regulatory body or a work comp or somebody like that requires we use them. CMS does not. And so even those transitions, although they have more specificity, just take what you know in I-9, apply it to I-10, and like you said, some of these other sort of types of transitions that we can make to make it easier on our practice, I think that will be fine if you have that assistance maybe, and we have the opportunity to provide you any assistance that you might need.
Dari, hold on just a minute. I've got a comment here from one of our people. Let me see what she has to say. Hold on.
Okay.
What was it? All right. Thank you, Dari. We're all good. And as you were saying, training is the key to success.
That's right.
And it's not just now, it's ongoing training,
That's
but this is a good time to take advantage of and get that training done and improve your processes. All right, so here's what I was just leading into, why it's valuable to bring in professional training resources, especially now, to get this done.
Right, and we've talked about already. It is a transition. There is more specificity. If each individual entity is told what they need to change, not throwing 100% of it on everybody at one time, but working as a team to make the transition happen, and showing people what part they're responsible for. What is billing responsible for? What is coding responsible for? The reason for bringing in additional resources is we do have small staffs in physician practices, even if they're group practices, and they don't have certified coders for the most part. So, you know, from the perspective of this is a coding change, this is a denials potential and billing impact, but it's more of a coding and documentation improvement change than it is anything else. And without having those certified coders, there may be a need to bring in people who can help make that transition happen quickly and then build on those processes with that assistance. You want to rely on experienced professionals to make sure that it's done correctly so that we don't have any negative impacts, particularly on revenue. And it's an investment in your business. There's no question that in the future, and we are going to probably be asked this, so I'll kind of save it for some of the questions, but in the future, there is going to be more emphasis on the ICD-10 code than in the past in ICD-9.
Yes.
And then consulting is available to address specific challenges that you may have. Again, process change is the key thing. I would take this as a absolute opportune moment for everyone to change their processes and help, even if it's in just the billing department or just the provider side of it, because our goal at the end of the day, whether it's ICD-10 or another transition that takes place in the future, our goal is to get claims correct on the front end so that we don't have to deal with the issues we've always dealt with in the billing department where we said it all runs downhill. Right. So this is a great opportunity to make those changes happen and come to fruition. And then networking with peers and professionals helps as well. Mm-hmm.
And we all know that we think we're all prepared, that we've taken all the right steps, but day of, you may come to realize that there are some challenges, that you do need some training. So a lot of people, you know, you might think you need all that training on the front end, but actually you realize afterwards, once you realize where the issues are, that's when you need the training and the process improvement.
That's right, and the folks on the back end really become, I'm sorry, not back end, the end result. They really become our eyes and ears, of course, and so hopefully in the change of those processes, it will help designate what are actual billing issues that we've had all along that have been mixed with all these other issues, coding and documentation and all of these things that billing is not as responsible for, but really becomes responsible for, at least in the communication to the front end and sending this information back to them to get these things resolved. We could actually get it right from front to back and get a clean claim to billers so that once our bill goes out the door, we know it's clean, and if it's not, we know what is a real billing issue versus what's a real coding issue or a documentation issue.
So like you said, I agree, this is a great opportunity to invest in your business. This is to improve your business going forward because it comes down to we're delivering better health care, but we're also improving our business so we can afford to continue delivering better health care.
That's right.
All right. So some training tips coming up. One I mentioned was picking those top 50 diagnostic codes you use in your office to create.
Right. And the cheat sheet, in all reality, now I do want to emphasize this, is if you have providers in the practices that are actually responsible for their own coding through the electronic medical record system, or even from a manual encounter form where they circled the codes, they are generally the ones that are responsible for the coding, and for making sure that it's correct. Again, we have to emphasize that we generally do not have coders that code for medical record documentation. So while that would be helpful from the perspective of the 50 diagnostic codes and cross-referencing, there could be a large number, depending on your specialty, of those codes that, I mean, we could end up with a very large hard copy encounter form, or a large list for a provider to be looking up in an in an encoder that is available in the electronic medical record. I will throw out there that our recommendation is train the providers on documentation and set up some type of system. Again, remember, we will be paid, and especially here in the first month or 2 months, we will be paid if our 3-digit category code is correct, even if it's an unspecified, just so that we get to the 7th digit or 5th digit or 4th digit, the most specific code. You know, we've said in the past, you know, those of us in this arena for a very long time, don't use unspecified, don't use unspecified. But in this case, if you're not familiar with the coding system, don't panic.
Right.
Utilize the unspecified code within that area. You can actually ask, a lot of your vendors are going to default the very first code to the unspecified code anyway. So don't kill your provider with day one, you're wrong, you're wrong, you're wrong. Take those 50 diagnostic codes, and I would map them, now that we're at a late stage, I would map those 50 diagnostic codes actually to the unspecified code in that category, and then that allows training for the provider to get to know the other ones once they start to look them up. Like you said, we don't know what we don't know.
Right.
I'm a coder. Yeah. I code a lot, and it's hard to look up some of these things in the encoders because the language has changed. Yes. And that's what a doctor would look it up by, is the language. Or if they don't, they know the number by heart. Well, they're not going to know the number by heart in ICD-10. They're not going to know the 3-digit category. Yeah. So at the very least, if we can give them that 3-digit category of those 50 diagnostic codes and maybe point it to the unspecified code in that area, then we can begin to train them on those changes. Good idea. In ICD-10. But it doesn't stop it, the process.
Right. Keep it moving.
That's right. And then quiz each other on the codes, have lunch and learn type sessions where you can share that information. As we talked about, if you get outside folks to come and help you, those types of things can help too, where you have experts that you might be able to call and get information in per your individual specialties. Prepare a list of your top payers, as you had talked about before, with their contact information, and find out who you're going to have problems with. Don't focus on the ones that do fine. If you don't have a certified coder, consider doing this, or bring in a resource again, and then have at least one copy of ICD-10 codebook in your office. You know, sometimes we just can't find it in that encoder so easily.
That's right.
Because all of their languages are different within the even encoder and how you look up things. So every encoder is going to be different, and to try to train a provider or somebody up front on all of those different encoders just wouldn't be beneficial, I think, to the entire process or streamlining it. So you should have a book, so you can flip to that real quick. Some of us need a book in our hand, right?
Right. We like the tangible book, hard copy.
That's exactly right. That's exactly right.
Thank you, Dari. Let's go on. Oh, yes, I know MMI has some special offers for our attendees today. I don't know if we want to take some questions first. Why don't you run through this very quickly, then we'll start taking some of these questions.
Yep, and what I'll say too is go ahead, everybody, and write down the link at the bottom of the page, mmiclasses.com/practice admin, so you all can see these offers too. They're all available on the website, so you can go on and see all 3 of them. But just so you know, these are all super time sensitive since they're ending October 1st. So you have 8 days to take advantage of any of these offers. The first one I'll quickly tell you is an assessment exam. I would recommend this to anybody who's already gone through some sort of training. They just want to make sure they're ready. It's also great for a manager or physician to be able to kind of assess and see where their staff is, you know, to see, okay, are you actually ready? Let's see the areas that you're not doing as well in. So it's an online exam administered through us. It's only $99 right now. So that's super helpful. That's great for post-implementation too, just to make sure. The second option is the one I'd highly recommend. It's our main training program, and it's been cut drastically. So it's normally $12.99. It's only $6.99 per person right now for all the attendees. And this includes basically everything you would need to really prepare. It's specifically for coders, billers, clinical staff can utilize it, especially if they want more information on the coding, and same with providers. It's about 6 to 8 hours, and this was created by Dari, so it's pre-recorded training videos of Dari actually doing the teaching, and then there's reading material that goes along with it. And the last one is just post-implementation on-site consults. I'm sure there's going to be questions on that too, but that's where Dari would actually go on-site post-implementation and assist, from the front end to the charge capture process all the way to billing and denials management, just to make sure everything's going smoothly. So write that link down, have it available. It'll all be available for the next 8 days.
And again, I remind people, we are recording this webinar, and it will be available probably by end of the day. And also, you can request just the PowerPoint if you want this information from marketing@practiceadmin.com. All right, thank you, Carleigh. Let's move on very quickly. Practice Admin, we're your technology partner for success. We have a lot of our customers out there. Just a reminder that we do have an ICD-10 crosswalk built into the product, and you see here screenshot showing briefly how it works, and it takes you to the GEMs. Also, as I mentioned earlier, you can run a primary diagnosis report to identify those top diagnosis codes, and I've heard that that's a really great way to create a cheat sheet. We also have an ICD-10 resource page with some other links to the payer readiness reports and lots of other good information. Also, the previous webinars have been recorded, and there's links on that page as well to listen to those. Okay, if you have questions to submit to Carleigh or Dari, please send them in now. I know we've got a couple. Great, I've got this one. Okay, where did it go? All right. Is ICD-10 going to replace CPT in the future?
That's a great question, actually. The ICD-10, actually CMS just put out a sort of yes, that's going to happen in the future, potentially with fee-for-service. A lot of us knew the transition to ICD-10 was going to take place this year when the Dr. Fix actually went through and passed. It was an 18-year bill that had not passed until this year, and it's about fee-for-service. And really, providers are the only ones with a fee-for-service payment model that is left in the industry. Our inpatient naturally is based on DRGs, and our outpatient hospital is based on APCs and groupers. And fee-for-service, the only place that now we get paid fee-for-service is providers. So CMS did put something out about 6 months ago that basically talked about that being their goal. What I do want to make sure I emphasize is if ICD-10 does replace CPT, and I wouldn't have said this last year, but I will say it this year because of their guide that they sent out, I would say that it's probably coming, but I would say this as well. I think that is an amazing opportunity in the outpatient setting for us, as particularly coders and billers, because of the fact that we already know CPT, and PCS really is they took 4,000 codes and basically enhanced it to about 76,000 codes. We already know that level of detail in CPT. So even if it does go that way, I think that's going to be more advantageous for that transition for outpatient than it was for inpatient to the level of detail they're doing PCS now. On the other side, I do want to say this is why it's going to be critical that our ICD-10 diagnosis codes are accurate, because there are HCC models now for managed care, and that's the hierarchical classifications. And I think that may be the payment system in the future for providers, but we have to be more accurate in our diagnosis submissions than we've ever been before. Right. No more unspecified hypertensions and those types of things. While we have those codes available, we need to be more specific because of that transition that will likely take place in the future.
Thank you, Dari. Okay, the next question. What recommendations would you give to billers about the impact that this may have on payments and denials from payers? And I think we discussed this a little bit, but I think we can add more to that.
We can. I think that the main emphasis to billing has to be, number one, the LCDs and the NCDs and the medical necessity edits that are going to change. I think that we're not talking about that as much. We're talking about, we kind of look at the big picture 100% monster in the room. And I think at this point, if most of you ran reports on your billing side, you would see that medical necessity edits are not a large reason for denials within the practices. And while there are some, I don't think that that is anything that would be at the top of the list for denials for individual facilities. So what I would do first, billing, is before we assume that it's going to have such a negative impact, number one, don't forget that if you're in the right 3-digit category and you have all of the digits available, payment likely will not be affected. Number two, if you understand your NCDs and LCDs in this next 6 months, I would look at those in more detail from a medical necessity perspective, and I would absolutely run a report and find out what my denials on medical necessity are or diagnosis for my procedures, and I would start from that point first, because again, I think you may be surprised that there are minimal denials for that. Now in the future that will be a bigger impact, but not for ICD-10 transition, I don't believe. I think that you'll be happy. You know, most of your denials are going to be higher levels of service. They're going to be based on your CPT, so and CPT modifiers and bundling edits and those types of things. They're not going to be on the ICD-10 as much.
Right. Thank you, Dari. And here again, a reminder, we've got a question. ICD-10 does not affect workers' compensation and personal injury claim submission. ICD-9 until that particular payer says so.
That is correct. I'm not sure if you were looking for a yes, that's true. It does not impact the workers' comp, the state farms, the homeowners insurance, and those types of things. Now, I do want to say we've been all over the country, and we have had a few states tell us that some small local entities are transitioning. So again, that goes back to run your most popular payers and call them and ask them. I mean, there may be some that are. I don't want to say it's going to be 100%, but for the most part, I think most of the work comp and those folks, everybody a couple of years ago said, oh, they'll definitely transition. And I'm like, after they've seen the delay and the difficulty that ICD-10 has posed for the rest of the industry, I'm not so sure.
Right.
So, but make sure you call them and ask them, because it may be different in your individual states.
Thank you. Yeah, and let's see, how do we know if our ERM vendors are prepared?
Your electronic medical record vendors, yeah, they're going to tell you they're prepared. I want to make sure that we emphasize. How do you know? I want to make sure I emphasize what they mean by being prepared.
Yes.
And this is why a lot of you are having them tell you, oh, you're responsible for now doing this. Oh, gee, thanks for letting us know. What they mean by prepared is they mean they have a code lookup system. That does not mean that those ICD-10 codes are going to be, that bad word again, converted within your EMR system on your favorites list, or the doctor isn't going to have to start from scratch on now transitioning. I haven't talked to a vendor yet in the EMR side that has actually transitioned or converted those ICD-9 codes to ICD-10 within the EMR. The provider is responsible for that. And so that's why we say make sure that your providers, that unspecified code, I would utilize that at all costs right now, just for the fact that if a provider goes in now in ICD-10 to look up, say, breast cancer, they can't find it because the language is so different. I think the providers are going to be the most impacted, and I think that there has been a thought out there from the EMR vendors that there is this conversion from I-9 to I-10. Well, if I-9 goes away, you don't have an option. So I-10 is going to be your only coding system, and a doctor can't put in what used to be. And remember, too, even with that conversion for the last 3 years, which has been there since 2012 for the most part because of electronic claim submissions and stuff like that, so, and 5010. But when we consider those lookups, please be understanding with your providers up front that they are going to have to potentially now scroll through 1 million codes. You know, I mean, I'm exaggerating, but that's going to be the problem. They will not convert your codes. They will not take your favorites list and populate it with the ICD-10 code. Nothing like that. That's why I tell you, have them now vendors, I would call your vendors and ask your vendors, your EMR vendors, if they're able to default the ICD-10 code in every category to the unspecified code. That's what I would ask them to do, and they are able to do that. You just need to make sure that you set it correctly in your front end product.
Good point.
So that your doctor doesn't get all of that information.
Thank you, Dari. And I have, let's see, another question coming in, again, going back to workers' comp. Do you think all California work comp companies are going to be ready October 1st? And I know I've seen something in the news about California. I was trying to remember what the article was, but
you know what? In fairness to the question asker, I would not be prepared to answer any individual state. But if those folks want to get hold of us, we'd be happy to look into that a little bit more, if they're going to be prepared or not. But again, the process would be the same, really, whether they're prepared or not. I would find it difficult, and no work comp started the transition from day one. And so even in the ones that are saying that they will eventually do it, I'm not sure that it will be day one.
Right.
So I would kind of look for that maybe in January for those that say, yes, we are going to convert if it's work comp. I would look at maybe January, because we only have 3 months at this point. I don't think that they would convert that quick.
Okay, just a few more questions coming in, and these do relate specifically to MMI and the training programs you're offering. I think this was in here, but let's repeat it. How long does the online training take to complete? And is there an exam with it?
Yep. Typically it's 6 to 8 hours. And like we were saying before, it's customizable. So, it depends on the specialty, depends on how much material, but typically it's 6 to 8 hours to go through all the videos and reading material. And then, yes, an exam is administered at the end. Online, you have 2 attempts, and then you do get issued a certificate
great.
and a membership to MMI.
Great. And then a final question here, is financing available for the training?
Yes. We partner with PayPal, so you can create a PayPal account. If you already have one, that's great, and do an interest repayment plan on any of our courses. So even our CEU courses, if you want to do it on the ICD-10 programs, I think they allow you to split it up to 6 months interest-free. And then if you do it through us, we can do custom plans too. We do up to 6 months through MMI.
Okay.
So, we break them up.
Great. Okay, this is it for today. We're running out of time. Quickly want to remind people, I've put Carleigh's contact information on here, or you can go to their website and get their information to contact them. This webinar has been recorded, and I should have it up by end of the day. If you want a copy of the PowerPoint, just drop me an email at marketing@practiceadmin. Also, we have ICD-10 resources on our website. Our next webinar is next Wednesday, and this is another open forum. Last call, we'll take your questions with CEO Eric Christ and our product management person, Barbie Elmore. And please send those questions in advance so we can prepare for them. And if we don't know the answers, we will get back to you and try to answer those. So again, this is Tamara Hyatt with Practice Admin. And thank you for joining us today. Thank you, Carleigh and Dari. You've been a huge help. Great information.
Great. Thanks, Tamara.